This video is a comment on the recent article published in Nature Medicine. I'm Professor Frank Joseph, consultant endocrinologist and founder of Dr. Frank's Weight Loss Clinic. So there was a really amazing positive piece of literature in the scientific publications in a journal called Nature Medicine that was published recently in a huge cohort of patients with type 2 diabetes. So this was from a group of researchers from Washington University in St. Louis, and they looked at nearly 250,000 patients with type 2 diabetes. And what was stark in these findings was that there was 42 different clinical conditions that improved, that had a better clinical outcome for the patients who were on the GLP-1 type medications. And that is staggering. And that included conditions that we would traditionally think of, like circulatory problems, heart disease, stroke, that kind of stuff, but also stuff that you wouldn't think of. There was a 13% reduction in opioid use. There was a 19% risk reduction of bulimia, which is an eating disorder. 18% reduction in schizophrenia and some other psychosis-related conditions. 10% reduction in suicidal ideation. Now that is staggering when you think about it. But we do know that people who struggle with their weight and have chronic illness have got lower moods, have got higher incidence of mental health related conditions. So any treatment that is showing such degree of benefit, we can't just look at it for the physical health benefits, but we got to look at it as a holistic thing and look at the mental health benefits too. So really, really positive findings. And again, another additional motivation for people to start looking after themselves and for us to use these really, really effective medications where people will benefit as time goes by.